I am an internist by training, but I've been in longevity medicine for the past 25 years, and I've been measuring central pressure for the past 20 or so years in my practice. There is a lot of data, many studies looking at the effect of central pressure on events. A study by Seffer et al. Showed that central pulse pressure and augmentation index is an independent predictor of mortality in end-stage renal disease and is more powerful than the brachial cuff pressure. The CAFE arm of the ASCOT trial, which some of you may be familiar with, the conduit artery function evaluation, looked at 2,199 patients, followed for 4 years. What they found was, even though they were treated to the same cuff pressure, there was a decrease in events in the calcium channel blocker and in the ACE inhibitor arm, because when they measured the central pressure, it was much lower, and that explained all of the difference in events. So treating to central pressure is going to give you a better picture about how effective your therapy is. And finally, the Strong Heart study looked at 2,400 American Indians from multiple states around the country and followed them for 5 years and found that non-invasively determined central pressure is more strongly related to vascular hypertrophy, that's atherosclerosis, extent of atherosclerosis, and cardiovascular events, that is brachial blood pressure. In my practice, I measure augmentation pressure, central pressure in all patients because I think it's important to keep the cardiovascular system as young as possible. So I use a stepped approach, though, because if they don't have hypertension necessarily, I'm not necessarily going to put them on medications that could have side effects. We all start with fat loss, visceral fat increases inflammation, metabolic syndrome, to get them to an ideal body composition, aerobic exercise, zone 2 plus some high intensity work. Paced breathing is known to lower sympathetic tone. It can reduce that tightening of the arterial tree that can help with that. Beetroot extract, some of you are familiar with things such as Neo40, that can help to increase nitric oxide production in your body after your microbiome works on it. Foods like arugula, spinach. And then if these don't work, I'll look at whether someone's postmenopausal or whether they have testosterone deficiency. Testosterone and estrogen replacement therapy can reduce arterial stiffness. I've seen it in my practice over and over again. And that's possibly one of the reasons why it improves cardiovascular outcomes. If I don't get to target, though, we have a great armamentarium of blood pressure medications to bring our patients' cardio age down, or their central pressures down. ACE inhibitors, angiotensin receptor blockers, calcium channel blockers, alpha blockers, but not diuretics and not beta blockers, unless they're the vasodilating form like carvedilol. Those can actually exacerbate central pressure, which is not to say they shouldn't be used perhaps in a beta blocker in a very young guy with a lot of sympathetic overdrive. But for the most part, I stick to the first three and sometimes alpha blockers. So I hope that with this presentation, you understand what central pressure is, how important it is for predicting events and for monitoring the health of the cardiovascular system. And I hope that it will make you want to measure this in your practice so that you can treat your patients with what I think is really 21st century standard of care of your patient's cardiovascular system.